Herbie Fund is an organization that was set up 25 years ago now to help children from third world countries with conditions that could not be managed close to home.
The Herbie Fund is quite special though, because what it does is provide children from overseas the same level of care that Canadian children and children from Ontario can expect to achieve, which is just about the best that you can get anywhere in the world.
This fund has grown from a relatively small operation into one that has treated numerous children from many different countries around the world.
In plastic and reconstructive surgery, we see children from all over the world with a variety of problems, from congenital problems to burns to very nasty motor vehicle accidents, and more recently to some war injuries that have happened to these children. These unfortunate kids really cannot get any kind of effective treatment in their home country, and that's why they come to us.
These children come from third world countries into the Canadian culture, which is very different from their own. And very often they give more to us than we give to them. And it really is a great opportunity to be able to lend our services to these children whose lives would never be made whole if they stayed in their own set of circumstances.
The Herbie Fund, which was started with Dr. Filler's efforts, has been a very interesting experience for many of the surgeons in the Department of Surgery at the hospital.
I think one of the things that's really important to understand when we are asked to become involved with children from the Herbie Foundation is that we're very lucky here at the Hospital of Sick Children to have a huge team of people.
To a large extent, the day-to-day care of the patients rests on the shoulders of our surgeons and our intensive care colleagues and our ward doctors, our echocardiographers and the people that look after the children in the cath lab.
We need to acknowledge the contribution of the nursing staff in the operating room and also on the floors, the allied health professionals, the physiotherapists, the occupational therapists that make up the members of the team, and I think that's one of the keys to success.
The Herbie Fund has been an enormous stimulus to all of us. I think it points out the exceptional opportunities that we have living in this country, for one thing, working in the incredible Hospital for Sick Children, for another, and being in the profession of medicine where we can actually deal with people that are in such need.
These children come to us in very destitute and almost desperate situations and leave and go home again in a much, much better condition and able to lead close to normal lives as possible.
We'll see children who are profoundly blue and really are not expected to live much longer. You can do an operation to close a hole in the heart and to get rid of the obstruction that's making them blue, and they can turn pink, look normal. They have a scar in their chest, but their parents, as far as they can tell, are completely normal children. They can run around and play with their friends and basically, have a complete new opportunity to live a normal life.
Numerous children that I have worked with have made lasting impacts on me. I remember Maria from the Philippines. Maria had a horrible infection when she was a little baby that left her basically with no nose and no upper lip. There was no way that she could be reconstructed in the Philippines, and she came to us literally a recluse, had never been socially integrated. She was about 7 years old and constantly had a handkerchief over her mouth and over her nose. All you could really see was her eyes. We did a variety of procedures in order to reconstruct her nose with bone grafts and with flaps from her forehead, skin grafts, etc. And at the end of it all, tissue expansion, we used virtually every technique in reconstructive surgery to deal with her. And at the end of it all, one of the greatest pleasures that I had was having her come into the clinic, walk around the hospital with no handkerchief, but opened her face, integrated with people, was conversational, and was a normal little child. Thanks to you people in the Herbie Fund who have provided the opportunities for this.
It's wonderful to see them come through the whole system here, to see these children who are really in desperate trouble when they arrive, smiling and happy and having more energy than they've ever had, even a week or two after their surgery is a wonderful thing.
they owe a great debt to the concept of the Herbie Fund and to each of the individual donors who really sponsor them to have a normal life.
I would like to congratulate the Herbie Fund for such tremendous success, and also to Bob Filler and Gina and Paul Godfrey for the leadership, for their ingenuity and clarity of purpose that have made this such a wonderful success.
I would encourage you all to continue your very generous support for this program for the benefit of the children worldwide, not just in the sense that it improves the care, but it also portrays Canada and the Hospital for Sick Children in a very enviable international position.
We're out to not just help people in our own community, but to help people in the community of the world. It speaks well for the quality of the people in this country who support the Herbie Fund, and it speaks well for the hospital that they have an interest beyond their walls and beyond their country.
And this is all because of the Herbie Fund and the people who work so hard to make it happen, and the contributors that open their wallets to help these children from all over. From my standpoint, I would like to thank you, the people who support the Herbie Fund, for making this all possible.